And in doing so, that helps us gather information so that we can analyze it and say, is this common? Is that not common? Is it associated with COVID-19 infection? What does the presence of smoking or an underlying condition have to make that condition worse? So we set up this case report form. It is being used now. It took some time to get going, and there's more than 10,000 case records in this, and we are hoping that more and more case records can be obtained so that we could better understand this. In addition, we're working with a number of countries who are conducting their own studies in their hospitals. Some of these are coming out through peer-reviewed publications, but those are done by individual hospitals. And that information is really critical for us to gather an evidence base to really understand what's happening. But with these syndromes, with these new syndromes that we hear about, those are identified by astute clinicians, astute nurses, astute medical professionals. And it's important that that's characterized. You've heard of this hyperinflammatory syndrome in children. That is something that is now being looked at by clinicians. This is among children, a very rare condition that seems to be among children. This is being looked at globally now. And there will be a case report form specifically for that so that we can collect standardized information and be able to understand this disease further.
He's from Al Arabiya Al Hadith. We have online Doha Al Zuhairi. Can you please hear? Can you hear us?
Yes, I can hear you. Can you hear me?
Please go ahead. Yes.
Okay. So my question is about any promising cure or vaccine, especially that we heard reports about showing negative side effects on patients who used hydroxychloroquine, and now eyes are on remdesivir. So any updates concerning that?
They want to supplement. So there are hundreds of clinical trials that are currently underway looking at different therapeutics, different drugs that could be used for COVID-19. What is important is that any of these potential therapeutics need to be evaluated properly through what are called randomized clinical trials to ensure that whatever agent is used provides safe and effective treatment. You mentioned side effects. So it's not only important to look at how well this works against maybe preventing infection or helping someone progress to more severe disease or preventing death. It's also very important that it doesn't have side effects. So there are a number of clinical trials underway. We have initiated with partners the Solidarity trial, which is a clinical trial that is evaluating a number of therapeutics, including remdesivir, including chloroquine. And there are more than 2,500 patients that have been enrolled in this clinical trial from, I think, 15 countries so far, but there are more than 100 countries that are willing to participate in this clinical trial. And the beauty of this is that by doing a clinical trial across multiple countries and across multiple hospitals, is that we can have enough patients to be able to evaluate the answer to which drugs are safe and effective quicker. And so as of right now, we don't have any drugs that have fulfilled all of the criteria through these randomized controlled trials, but it is incredible that there are so many that are underway, and we look forward in the coming months to finding out more about which drugs are safe and effective for COVID-19.
From EFE News Agency, Spanish-speaking news agency, Antonio? Antonio, can you please unmute? Antonio?
Sí. Sí, gracias. Mi consulta es sobre las medidas de etiqueta social que se tendrán que asumir en la fase de desescalada que ya se está viviendo en Europa. ¿Cuáles creen que serán? Y si, por ejemplo, creen que tendrán que pasar meses o incluso años antes de que las personas puedan saludarse dándose un beso o estrechándose la mano. Muchas gracias.
Yeah, I think that's you reflect our fervent desire of all human beings to reconnect with each other, and we share that sentiment. We haven't shaken hands or hugged our friends in 18 weeks either, or seen our family, but it is a difficult process, both socially, psychologically, and economically for many people. But I think everyone is doing that because we want to protect those we love, and we want to ensure that we end this as quickly as possible. So we're going to have to monitor this very carefully. We are, and as WHO, we are monitoring. We've tried, and it's very difficult. We've tried to work out the whole selection of measures that have been put in place by countries, and as those measures are lifted, we're looking at which countries are taking away which, and we will monitor the epidemiology in those countries. And if it may cause a jump in cases, we'll have to think about that again. One being the schools is a very good example as people return to work. I think the thing, and I think we're seeing, is that a careful and measured return to those kind of normal activities of work and school, especially if they're done with density reduction, physical distancing and hygiene in place, seem to be very prudent and practical. Where we're going to maybe have to accept a little bit more time is going to be around mass gatherings, things like large-scale gatherings, concerts. We're coming into the summertime in Europe, North America and other places in Asia. And this is the time when people gather en masse. We go to big events, and it's going to be much more difficult to make those perfectly safe. And life is life. There's no zero risk. We all have to. We do it every day. We manage the risks in our lives. And what we need to do collectively is reduce the risks associated with COVID transmission to an absolute minimum, and then recognize what risk is left and be able to mitigate that risk. And we would, at this point, in countries where we see downward trends in disease, where we see a strong public health surveillance in place, where we see a healthcare system that's capable of treating cases, where we see a committed community willing to continue with personal and community measures, I believe there's a path out. But it may involve schools or partial school opening, partial workplace opening, those working from home that can, those that need to go to work, being properly protected in place. And especially those people who have to work in high density conditions, we have to make special provision for their occupational health and safety. Then we have to look very carefully at events that bring people together en masse, and see how best we can bring, for example, we spoke the last day about football, and other spectator sports. Maybe the sports can start again, but the spectators may have to stay away for a little bit longer. So, and I think everyone has a stake in this. This isn't just the purview of scientists. This is a dialogue with communities. This isn't just science spitting out orders that then are implemented by people. There is community activities, social life is a dynamic process, and there needs to be a good dialogue. Very often best placed to look at what's important and look at what's relevant for them, but always with risk in mind, and listening to the science and listening to the public health advice. I'm sorry, I've been long-winded in my response because I think the issue is so important. There is a path out, but we must remain ever vigilant, and we may have to have a significant alteration to our lifestyles until we get to a point where it's all bad. I mean, we've seen some benefits to our environment, we've seen some benefits to our connectedness. Strangely enough, even though we've been disconnected physically, I think many of us have recognized how important those connections are. So I think we need to move forward recognizing that it's been and is and will be for many populations and countries with weak health systems. Still, this is a big challenge, and we're not through it yet in many countries. And as some countries come out of lockdown and come out of these measures, they can offer hope to communities who are entering into epidemic situations. Learn lessons from what everyone has done, transfer resources, and help other countries to fight the fight they have to fight. And in the end of this, as Dr. Tedros says again and again, through solidarity, we will win the fight, and nobody is safe until everybody's safe. Thank you.
Yeah, thank you so much. My question is related to temperature range. That is there any study, any experiment, or any lab research that what is the temperature range that this virus can survive within the human body as well as in the open environment.
That is a very good question and a very specific question. Our studies that have evaluated